Hi, I'm Anne with Lighthouse Coding. Welcome to this introduction to anatomy and physiology for coders. We're going to start by discussing what exactly is the study of anatomy and physiology. Anatomy is the scientific study of the body's structures. The term anatomy comes from the Greek root meaning to cut apart. This stems from the earliest study of anatomy, which was the observation of the wounds and injuries of soldiers. The study of corpses was forbidden during the Middle Ages. However, eventually the dissection of dead bodies came to be allowed in the 20th century. Dissection is the cutting apart of the body to observe the physical attributes of the structures in relation to each other. Today, cadaver dissection plays a large role in our understanding of how the body is structured and functions. While anatomy studies the structures and makeup of the body and how it's organized, physiology is the scientific study of the function of the body. The word physiology comes from the root word physio, which means physical or relationship to nature. Physiology deals with the physical aspects of the body that keep us alive and functioning. It's difficult to separate the topics of anatomy and physiology because the function of the body depends on its anatomical structures. Let's take a look at the level of organization in the human body. The body is made up of parts that are made up of other parts, which are increasingly complex. While the smallest materials in the body are composed of chemicals and include atoms, subatomic particles, molecules, and macromolecules, the smallest unit that we'll be looking at here is the cell. When specialized types of cells come together in masses or layers and perform a special function, this is called a tissue. Groups of tissues also come together to form special functions, and these are known as organs. Likewise, organs together form organ systems, and all of these components together make up the human organism. Cells are the basic unit of structure and function in the body. Cells vary by type in both their makeup and the way that they behave. They become specialized through a process called cellular differentiation. Cells are made up of many smaller parts, and we'll study those in more depth later in the course. For now, it's important to note that cells contain three major components: a membrane, cytoplasm, and a nucleus. Examples of different kinds of cells are muscle cells and nerve cells. When cells come together into layers or masses to perform a specific function, they become a tissue. Primary types of tissues are connective, epithelium, muscle, and nervous. Connective tissue is the tissue that supports, protects, and gives structure to other tissues and organs in the body. Examples are bone, cartilage, and fat. Epithelial tissue forms a covering over the internal and external surfaces of the body. It also lines the body cavities and organs. An example of this would be the endothelial lining of the blood vessels. Muscular tissue is broken down into three types: heart, skeletal, and visceral. Visceral meaning muscular organ tissue like that found in the intestines or the stomach. This is also known as smooth muscle. Nervous tissue is responsible for coordination and control of body activities and is located in the brain, spinal canal, and nerves. During your work as a medical coder, you'll come across terms that describe certain other types of tissue. Autologous refers to tissue that's obtained from the same individual or the self, like an autologous stem cell transplant. In that procedure, a patient's healthy stem cells are harvested from the blood or bone marrow before treatment, stored, and then given back to the patient after treatment. They were obtained from the same individual. Non-autologous means just what it sounds like: tissue obtained from another individual. An example of this would be a non-autologous tendon graft. Surgeons will often use cadaver tissue like tendons during a surgery. Allogeneic is another word for non-autologous. Allo means different and gen means origin, tissue coming from a different origin than the patient. Zooplastic tissue is taken from an animal. This comes from the root word zoo, which means animal, and the suffix plastic, which means about the formation or development of something. An example of this would be a patient with a bioprosthetic or zooplastic heart valve transplant. These are usually taken from cows, pigs, or horses. Syngeneic tissue is tissue obtained from an identical twin. Syn means together or joined, and gen means origin. This refers to the individuals sharing the same DNA. A common syngeneic tissue transplant may be that of stem cells from one twin to another. Organs are formed by two or more tissues, and they have specific functions. Examples include the skin, gallbladder, heart, and kidney. We'll learn more about each of these organs and its function later in the course. When a group of organs comes together to perform a common function, this is called an organ system or a body system. As we go deeper into our study of anatomy and physiology, we'll learn about each of the body systems, the organs that make them up, and the special functions that each perform. And we'll see how each of the organ systems works together to create the amazing organism that is the human being. Before we delve too far into our study of anatomy and physiology, it's important to talk about homeostasis. Homeostasis is the maintenance of a normal balance within the body. This is the state that a body is always working to maintain. Nearly all of the cells, whether part of a tissue, organ, or organ system, work together to maintain homeostasis. Sometimes some factors cause our internal balance to shift. When the body can no longer maintain balance in the context of trauma or pathogens, disease, dysfunction, and even death can result. Because cells are interdependent, when cellular dysfunction is substantial, other cells or the entire organism may suffer. By having an understanding of homeostasis, you'll be able to recognize disease when it's documented. As noted before, homeostasis is the condition in which a system, such as the human body, is maintained in a more or less steady state. It is the job of the cells, tissues, organs, and organ systems throughout the body to maintain many different variables within narrow ranges that are compatible with life. Keeping a stable internal environment requires continuous monitoring of the internal environment and constantly making adjustments to keep things in balance. For any given variable, such as body temperature or blood glucose level, there is a particular set point that is the physiological optimum value. For example, the set point for human body temperature is about 37 degrees Celsius or 98.6 degrees Fahrenheit. As the body works to maintain homeostasis for temperature or any other variable, the value typically fluctuates around that set point. Such fluctuations are normal as long as they do not become too extreme. The spread of values within which such fluctuations are considered insignificant is called the normal range. In the case of body temperature, for example, the normal range for an adult is about 36.5 to 37.5 degrees Celsius, or 97.7 to 99.5 degrees Fahrenheit. Homeostasis is normally maintained in the body by an extremely complex balancing act. Regardless of the variable being kept within its normal range, maintaining homeostasis requires at least 4 interacting components: a stimulus, sensor, control center, and an effector. Sunlight acts as a stimulus, warming the skin on the body. The skin senses the rise in body temperature and sends this information to the brain. This triggers a command from the control center. This command affects the body by increasing sweating through the skin, vasodilation, skin hairs being lowered, and a reduced metabolic rate starting. These responses will cause a decrease in body temperature, maintaining a normal temperature range, thus keeping the body in homeostatic equilibrium. As we study the body, we need a way to describe how parts of the body fall in relationship to others. Anatomical position refers to the positioning of the body when it's standing upright, face forward, arms at the sides, and palms facing forward. This position is also known as the supine position, and it allows healthcare professionals to discuss parts of the body using the same point of reference. As we look at the body in an anatomical position, we can use terms to describe the relative position or location of one body part with respect to another. These terms include words such as superior and inferior. Superior means towards the head of the body, and inferior means away from the head. Using anatomical position, we can say that the knee is inferior to the shoulder. It is farther away from the head. Another example would be medial and lateral. Medial means towards the middle, and lateral means to the side or away from the middle. Again, Using anatomic position, we could say that the little toe is located on the lateral side of the foot and the middle toe is medial to the outside of the foot. Let's define some of the terms that you'll see relating to position. Anterior, also called ventral, means the front of the body, and posterior, also called dorsal, means the back of the body. As a coder, you may see providers order a PA chest X-ray. This stands for postero-anterior. In a PA chest X-ray, the X-ray source is positioned so that the X-ray enters through the posterior, or the back part of the chest, and exits out of the anterior, or front part of the chest. Bilateral refers to structures or conditions on both sides of the body. Remember, bi means two. For example, a patient may present to the ER with abrasions on bilateral hands. That means they have abrasions on the right and the left hands. Ipsilateral refers to structures or conditions on the same side of the body. Ipsum means the same. An example of this would be a tumor of the right brain that affects the ipsilateral vision. That means that the vision in the right eye, the same side as the brain tumor, is affected. And contralateral refers to opposite sides. Contra means opposite or against. For example, a stroke in the right brain may cause paralysis on the contralateral or opposite side of the body. Proximal means near to the point of attachment at the center of the body, and distal means farther away from the point of attachment at the center of the body. The elbow is proximal to the wrist because it's closer to the point of attachment of the arm to the trunk. The toes are distal to the knee since they are farther away from the point of attachment to the trunk. Superficial means near to the surface, and deep means away from the surface. You'll see these terms used in procedures, and it could make a difference in the code assigned. For example, there are separate codes for removal of an implanted device depending on whether the device is superficial, like a buried wire closer to the surface of the body, or deep, which may be a nail all the way down in the bone. The body can be broken up into 3 planes. One such plane is the sagittal plane. A sagittal plane describes a lengthwise division of the body into right and left sides. If the sagittal plane divides the body into equal parts, it's called mid-sagittal. If the sagittal plane is lateral to the midline, it's called parasagittal. The transverse plane divides the body into superior and inferior sections, and the frontal plane divides the body into anterior and posterior portions. Now let's take a look at some of the more general anatomic terms. We'll start with the body cavities. There are 5 major body cavities. 2 of them are considered dorsal, and remember dorsal means back, and 3 of them are considered ventral, ventral meaning front. The dorsal cavities are in the upper back portion of the body, and they include the cranial and vertebral cavities. The cranial cavity holds the brain, and the vertebral cavity includes the spinal cord, which is surrounded by the backbone, also known as the vertebrae. The next 3 cavities are considered ventral. These include the thoracic, abdominal, and pelvic cavities. A thin muscle called the diaphragm divides the thoracic and abdominal cavities. Inside the thoracic cavity is a compartment called the mediastinum. This compartment contains most of the organs of the thoracic cavity, such as the heart, esophagus, trachea, and thymus. The lungs do not fall within the mediastinum. They are positioned outside of the mediastinum on the right and left sides. It's important to note that you'll sometimes see the organs of the ventral cavities referred to as viscera. Viscer means internal organs, so when you see mention of a visceral problem, it means a problem in an organ. The abdominal cavity includes the following viscera: the stomach, liver, spleen, gallbladder, kidneys, and the small and large intestines. The pelvic cavity contains the internal reproductive organs, the bladder, and the end of the large intestine. Each of the 3 ventral cavities, the thoracic, abdominal, and pelvic, is lined by a serous membrane. The membrane not only lines the internal surface of the cavity, but it also folds back and lines the surface of each of the viscera or organs. Let's see if we can predict the meaning of serous based on the meaning of the word parts. Ser means to protect, and ous means pertaining to. So the word serous means pertaining to protection. This is a lining that protects the structures of each of these body cavities. What happens is that the serous membrane secretes a slippery fluid that forms a layer of protection between the lining of the wall of the cavity and the layer that covers the organs. The serous membrane lining the thoracic cavity and surrounding the lungs is called the pleura. The serous membrane that surrounds the heart is called the pericardium. The pericardium is made up of two parts: the visceral layer, which forms a layer over the organs, and the parietal layer, the layer that creates a lining over the wall of the cavity. The pericardium protects and lubricates your heart and keeps it in place within your chest. In the abdominal and pelvic cavities, this lining is called the peritoneal membrane. Let's talk more about body regions. Sometimes you'll see the abdominal cavity and the pelvic cavity grouped into one term, the abdominal pelvic cavity. Really, this is one large cavity, and it's not divided like the thoracic cavity is divided from the abdominal cavity by the diaphragm. If we look at the abdominal and pelvic cavities together, as in this diagram, we can imagine the abdominal pelvic cavity divided into 9 regions. These are the epigastric, right and left hypochondriac, umbilical, right and left lateral lumbar, pubic, and the right and left inguinal regions. It's important to learn these regions, as you'll see this documentation when patients present with abdominal pain or other problems. Often the provider will say that the patient has epigastric pain or umbilical pain, and it's the coder's job to be able to understand where the pain is located. That's it for today. Please refer to your handouts for diagrams and definitions. Remember to study each day and to make these new words a part of your vocabulary. I'll see you next lesson.